Hello everyone. Today we'll discuss about an important topic, that is the association of HIV and nervous system. So this is the most often asked thing in medicine rounds or vivas and even in the practice. So we'll discuss about it today. So this nervous system manifestations of HIV can be easily listed out if we follow this pattern. So if we consider this as brain parenchyma, spinal cord and the nerves, so we have to approach stepwise. For example, the outermost layer here is meningeal layers. So first thing to consider is meningitis. So in this one, we know that mainly it is cryptococcal meningitis is the first thing. Then comes brain parenchyma. Here we can tell that the outermost structure will be gray matter. So second one is, what are the manifestations at gray matter? So one thing to remember is AIDS dementia complex. AIDS dementia complex. So there will be cognitive decline in patient with HIV. This is related to the gray matter. Then coming to the white matter, we can consider PML, progressive multifocal leukoencephalopathy. So as we know, this is by JC virus and it can manifest in various forms, like the patient can present with seizures or visual disturbances or again cognitive dysfunction also. This is about PML. And in parenchyma only, next thing to consider is about lymphomas, CNS lymphomas, or there can be MEDS also, secondaries. If it is due to primary, we have to consider Epstein-Barr virus. This is the thing related to parenchyma. And as we discussed about the meningitis, related to the brain parenchyma, it will be, fifth one is encephalitis. So encephalitis. There are various viruses like HSV or again Epstein-Barr virus or HIV itself, the virus itself can cause encephalitis. So these are few things about parenchyma. And then coming to the spinal cord, we call it as, sixth one is related to spinal cord, we call it as vacuolar myelopathy. So HIV is considered as one of the reason for tropical spastic paraparesis. Usually females in the age of about 30 to 60 years, they will present with slowly progressive weakness of the lower limbs, and there will be bowel bladder involvement also, bowel bladder dysfunction, but there will not be much sensory involvement. Sensory is less prominent. So this is the usual presentation of the vacuolar myelopathy considering spinal cord. Now if we consider both brain and spinal cord, the seventh manifestation will be acute disseminated encephalomyelitis, ADEM. This is one of the autoimmune manifestations. Which can be seen in relation with HIV. Coming to the peripheral nerves. So here we can consider peripheral nerves as the eighth manifestation. So that is nothing but peripheral neuropathy. It can present in various forms, but most often it will be distal, sensory predominant, polyneuropathy. And when like the HIV virus itself can cause peripheral neuropathy, and the treatment related to HIV, that is some ART medications, especially NRTIs like stavudine, will lead to peripheral neuropathy. And once we decide about ART, when we are listing out, once we reach ART, we have to think of other medications also like NNRTA, mainly efavirenz. Efavirenz is prone to cause psychiatric manifestations like disturbed sleep disturbance, anxiety, depression, etc. And some integrase inhibitors are prone to cause suicidal mood changes. So this is related to the medications of HIV, that is ART. So these are few manifestations of nervous system in relation with HIV. So we can go in this particular pattern to list out all the possible manifestations. Do read more about the association. Thank you so much.